fragile Amna is just 20 days old. She was born nearly 3 months premature. Home is a 10-year-old incubator. Nearby, used needles litter the filthy corridors. But of more concern to Amna's mother is the rotting garbage and an open cesspool 2 stories below. I'm afraid the smell and diseases coming from that pool will make her even more sick, says Amna's mother. I tried to go to another hospital, but they were all full. This is the top teaching hospital for pediatric medicine. But in the throes of Iraq's painful reconstruction, the hospital languishes. When the former regime wanted the world to see suffering Iraqi children, this is where the television cameras were pointed. They've come from all over the country. Under Saddam, medical facilities were virtually non-existent outside the capital. Desperate families are too poor to pay for treatment. Only 3 out of 6 wards are operating because there's not enough staff or functioning equipment. Adnan Jassim comes from the city of Najaf, 2 hours south of Baghdad by bus. He spends 5 days a week here, sleeping on the cold floors at night so that his 5-year-old son can get treatment for leukemia. Adnan's son Mohammed shares his bed with another child. Chemotherapy delivered through tangled tubes, but vital elements of the cocktail are absent. They haven't been available in Iraq for years. Doctors say his condition is acute, but they're doing everything for him. His father disagrees. Yes, they have the best doctors in Iraq, he says, but there are only 4 specialists and they're gone by midday. Then there's a lack of basic medicine, so we have to buy it outside. There's no clean drinking water, and some children are sleeping on the floors. In another questionable practice, the hospital distributes Mohammed's weekly medication allowance at the start of each week, and to ensure supply, it's given directly to the family. During the war, the hospital miraculously escaped bombs and looting. But 10 months on, while much of the country is being cleaned up and rebuilt, this facility is awash with decay. Today, the biggest threat to children here is the risk of cross-infection due to unsanitary conditions and overcrowding. At times, up to 3 or 4 patients share one bed. So who is to blame?
The manager of the hospital is responsible for the situation. We don't have the proper man to manage the hospital. And I think we have to change this manager.
Is that what the other doctors say too?
Yeah.
There's a problem with the management?
Yeah, the problem with the management. Because in the former regime, there were a good manager to manage the hospitals. But now they are less efficient.
The hospital's deputy manager admits cross-infection rates are high because not a single child is turned away.
It is not designed for such capacity. It's not designed for such number. It is only designed as a hospital for receiving referral cases.
You say money's been given, for example, to repair pipes and elevators.
Yes.
But there's only one lift or elevator working, and I understand that none of the toilets in the hospital work. So where does the money go?
No. There is many things happen to the hospital. I'll give you an example, but I'll take it to you. If you saw the hospital after war and you saw it now, you can have a good imagination. A lot of things is done for this hospital.
Iraq's Ministry of Health says it's begun a new strategy to overhaul the country's decrepit health sector. $1.2 billion to be spent on state-of-the-art hospitals, medicine, new ambulances, equipment and training.
It's our duty to change the situation which we inherited from the old regime. Some of these hospitals has been built in 1950 without modernization, without changing. And some of them, they are not in a good state to be used as a hospitals.
Mohammed's father prays for his son to get treatment outside Iraq. But the departure of international agencies due to the bombs and shootings has halted humanitarian evacuations. The Americans said they would build hospitals, treat children, bring freedom and democracy, he says. But now all you find is killing, illness and death.
The gap is big. We are doing our best, and probably you will see a couple of people dying, but hopefully that everything will change as soon as possible.
Adnan Jassim lingers helplessly in the corridors of Saddam's former showpiece. And Mohammed, innocently caught in the gap between past and future, may not live long enough to see the promise of a new Iraq.